my name is Crystal Sosa, and right now I'm doing my internship hours in Sydney, Australia at a facility called Therapies for Kids. So, question number 1. Working with the VA healthcare system, SCI unit has exposed me to different mechanisms or disorders that can cause SCI. What has been the most challenging disorder or disability you have encountered in your respective internship? So the most challenging disorder I've worked with is children with cerebral palsy. Our facility is known for this, but most of the children I've worked with have cerebral palsy or a form of it. So trying to treat them is difficult because each one, they're not the same. One is more severe than the other, yet they're the same type of cerebral palsy. And it's just, you can see the involuntary movements that this disorder causes, as well as the stiffness in their muscles that they have. Okay, question number 2. What was your favorite population to work with, and how was this population impacted you? So this is my first placement, and the population I'm working with right now are children ranging from 4 years to 14 years of age. But we do have this one adult that's 34 years old, and he's been coming to the facility since he was a toddler. So that's the reason he's been with the facility for so long, because he's just grown up there. Question number 3. What experience or activity has been the most valuable for you during your internship? Since this is my first internship, the whole thing has been valuable for me. Learning from assessments to therapy treatments to all kinds of things. I've never done anything like this. So any of this information is new to me and helpful to me in any way. 4. What have you struggled with the most, and how have you helped yourself overcome the struggle? Okay, so with cerebral palsy, there's hypertonia and hypotonia, as well as there's 4 types of cerebral palsy, and then the child can be a hemi or a quad. So learning each type, and each child can be more than one type of cerebral palsy, as well as the symptoms that come with each type, is hard to memorize and learn. And because these children were more than one type of cerebral palsy, trying to figure out what he might have or what she might have was always difficult for me. I can see like the involuntary movements, and I know that it's spastic, but they can have other movements, or they might not be showing the involuntary movements, but might show the stiffness. So it was always difficult trying to guess what this child might have. 5. What is the group that you enjoyed participating in the most, and why? So I enjoyed all the children. All of them were great to work with, no matter what disability, or if they didn't even have a disability, because we would get normal children that just needed to meet milestones and to go to kindergarten, and we would just work either jump rope or teach them how to ride bike or different things like that. So we had all types of children come into the facility that we treated, as well as I didn't really think I would be able to deal with children, since I've met a lot of bratty children and thought, oh no, I hope they're not misbehaved, but they were all very well behaved. We barely had tantrums. Like, the only naughty children were the siblings of the children we were having therapy with, and then we can just put them in the ball pit and didn't have to worry about them. 6. How has your confidence changed from your first session to your last few weeks? So like I said, since it was my first internship or any type of shadowing or volunteering, I was extremely nervous. I didn't know what to expect, didn't know what to do, but I was wanting to learn, so I was involved. I asked questions, I helped out however I could. I was always following the therapist and seeing what I can do or what they've learned, or always have questions for them, so that helped. As well as I was able to treat some children we made like a goal plan, me and the therapist, and then I was able to treat the child, and we would just pretty much play games, or I would watch them do obstacle courses and assess them wherever they needed. If they needed like a certain hand or guidance and things like that, I would help with. 7. What is one activity that you enjoyed observing during your internship? So in our facility, we had speech, occupation, and physical therapists all in one area. So a child would one day have a session with the speech, and then the physical therapy, and then the next day occupational. But what was good about this, since it was all in-house, the therapists would talk to each other, and we can see how to like be able to incorporate each therapy into the child's session. So that was interesting. We'd have the speech therapist have the child sit on a bouncy ball to help with his core, or we would, with the child, have him sit down cross-legged with a table on top, but like drawing, and we would be telling him, okay, draw a flower, draw a rainbow. So we'd incorporate all of the therapies in one session, which is beneficial for the child. Okay, number 8. Give an example of a physical program or an activity that would benefit a person with paralysis. So with the children we had that were quads, what we would do is have them sit on a peanut and then use the ladder and have them try to stand up themselves by using all the weight on their arms. But what would help a lot for them is being able to like push that weight through would be wraps. We would have wraps on them, so the wraps would help. It also, like, if they were hemis, we would have them like on a boat and have the wraps on their arms, so they're sitting up like this, and then we tilt them, and then them try to be able to push their weight back to the opposite end. So that would help with any form of paralysis, whether it be their legs, or if they also have paralysis in their arms or one arm, if they're a hemi, all different types. 9. Explain the assessment process used at your internship site. So we did have children with cerebral palsy. Those assessments were more in-depth and had to do with range and degrees and all types of things like that. Whereas we'd have a lot of new parents come in, and they weren't told by their doctors, but they noticed it on their children that their heads like had a little like squished. It wasn't symmetrical, and that was the plagiocephaly assessments. So we would literally just advise parents to like tilt the child's head to the other way so the flattening goes away, as well as the assessments of torticollis, which is pretty much the baby has like a little lump in his neck. Either it's like a benign tumor, or it's just he favors a side. So with those assessments, the therapist would literally just work out his neck, have him tilt, have him move all around. And because the torticollis is this muscle was lengthened and this one was shortened, we would always have them either laying down and having them like try to lift their head to that lengthened side, so they're able to lengthen this muscle that's been all constricted from being tilted to that side for a while. So there were those assessments, as well as that regular like baby assessment, seeing if they can lift their head, when they're on prone, if they can lift their arms, or supine as well, how much rotation they can do. Okay, 10. How would you motivate clients that never participate? So I had this client that happened to have complex regional pain syndrome. So he believed he was in pain, but he wasn't in pain. And he had a trampoline accident that he hurt his neck. So he thought the pain was in his back and throughout his neck. So trying to get him motivated was very hard. He didn't want to do any physical activity because he thought he was in pain. He like stopped doing sports because he was in too much pain. So what I ended up doing at therapy was just play with him. We ended up having like a whole bunch of fun games. We did obstacle courses, we did gladiators, We did scooter races, and all these things were like making him work out his arms or any form of activity to have him realize that he can push through the pain. And once he keeps pushing through the pain, he'll realize that maybe he's not in that much pain. 11. What is your go-to activity? So most of the therapists, as well as me, had a go-to activity, and it was an obstacle course. And this obstacle course started off with an A-frame and then went to a balance beam that had pegs on it, and this caused like the child to lift his leg either higher or lower to try to get to the other side and walk across. Then at the end of that would be another A-frame, a smaller one. They'd climb over that, climb to the other side, and then walk this like inclined ladder. Then walk to this baby A-frame over to the balance beam. And then on the balance beam, it was like a really wobbly beam. So we'd like have them jump and work on jumping and trying to balance themselves. And then from the balance beam, they would jump to a soft red mat, and they loved that. But throughout this activity, we could have them chase the stickers or have them pick up bean bags and throw them. Like different things could have been used with this obstacle course. So it was everybody's go-to because it was easy, it was there, and all the children loved it. Okay, 12. When do you feel most proud or happy during your daily routine at your internship? So the proudest moment I had was when parents and therapists would actually ask for me to sit in, or parents would ask me, oh, can you please do therapy with my child? Which I was fine with because the therapist would give us a goal or certain games we can play with the child. So we would just go, I would play with the child, we'd go on the obstacle courses. They wouldn't even know they were having therapy. 14. What have you found to be unique to working with the population you are currently providing service for, and what has working with this population cleared up any preconceived notions? Okay, so yes, like I said, I have met a lot of very misbehaved children, spoiled children. So coming into this therapy program, I was apprehensive because I thought it was going to be a lot of work having to deal with these children that are misbehaved. But like I said, no, they were very well behaved. Like the therapist would even tell us stories of like the children being the children with the disorders being misbehaved. And at the end, I did not see one, like the most I would get is screaming from a child saying he didn't want to do therapy. But most of them were so well behaved. They participated, they were excited, like they just liked it. I didn't have to deal with any spoiledness or misbehaving or temper tantrums or anything. So the preconception that I had of misbehaved children went away, and they actually made me want to work with children. Okay, question 16. Were there any new tools used in placement that you have not come across before, and if so, what can you explain and how does it work? Okay, so in my facility, we are the first. There's only 6 in the world of these harnesses, originated from Delaware, the University of Delaware. And in Australia, she's the first facility to have this harness system. So this harness system is like a huge contraption that goes up on it's up to the roof, and the children can just be strapped in and they can walk around and roam around, and we have like all types of games surrounding this harness system. So this harness system was great for all types of therapy. This was great for our children who weren't mobile enough. We would just put them in, and with a little bit of pushing from their own feet, they were able to walk to things that they wanted. As well as for the other children that were a little heavier, that we would need a whole bunch of people assisting in the therapy, and sometimes we didn't have enough hands to help. So this harness system would be great because it would just consist of 2 people, and that's it, instead of needing 4 or 5 people, one assisting the leg, another assisting the other leg, another assisting the arms, someone straightening the child so he's posturally correct. But with this system, with this harness system, you'd put on their little vest, correct them, adjust the strings, and the child would be in great and being able to do whatever therapy we had planned for him or her. But yeah. But thank you. Bye.